Hello, my name is Ishume Kathy on the program Safe Life. Maintaining our teeth in a healthy condition is vital for our dental system. Join me as Dr. Ntwatwa, a professional dentist, takes us through. You're most welcome, Dr. Ntwatwa.
Thank you, Kathy. Hello, viewers, and Happy New Year. It's nice to be here once again with you.
Dr. Ntwatwa, what are some of the common diseases that are associated with the dental system?
3 common diseases. Dental caries.
Yes.
Tooth decay.
Yes.
The second one is gum disease or periodontal disease. And you could call another one tooth sensitivity. Tooth decay is an infection of the tooth structure by bacteria. It's basically an infection. And the bacteria produce acid and eat away the internal part of the tooth, creating a hole. That's basically tooth decay.
How can they prevent it, or what is the treatment?
Well, in preventing tooth decay, one needs to know, again, as I said, the cause. It's a bacterial infection. So if you try to avoid or get rid of the bacteria early, then you can help prevent tooth decay. And the best way of doing that is to keep your teeth very clean for as long as possible. Secondly, it's known that sugar promotes the health of the bacteria that have invaded the teeth. So if you can avoid taking sugar frequently,
yes,
then you can also avoid the tooth decay. So you need to cut out sweets, toffees, really many things which contain processed sugar.
Okay.
Cakes, biscuits, things like that.
Okay. You talked about tooth sensitivity. All of us may not know what exactly it is. Would you elaborate more about the tooth sensitivity?
Tooth sensitivity is basically a sensation that one feels in the teeth when you pass air over the teeth. Sometimes when you take something cold to drink, it's basically a short, sharp pain from the teeth, but it's not caused by tooth decay. It's caused by exposing dentine to the environment.
Okay, how is it treated, or is there anything to do when you're getting that kind of sensitivity? Let's say I've taken cold water. Does it normally happen when you normally take cold water, or?
Yes, it does happen if you have tooth sensitivity. I think it's important, first of all, to educate the person, or to first find out what is the cause.
Okay.
So you investigate to try and find out the cause. And sometimes the way the teeth present can indicate the cause. For example, if your gums have receded because you have been brushing very hard with a hard toothbrush, then you will have the effect of the gum receding, and also the edge of the teeth. At the level of the gum, there will be a groove, and in that groove it can be very sensitive. So you can visually see that the gums have receded, and it's more likely to be caused by the toothbrush. If, however, it is on the molars or the back parts of the teeth, then you can see that it's something that one is chewing, more likely, especially something that contains acid. So that's a different cause.
What kind of toothbrushes are we supposed to use? And you talked about using a lot of force as we brush. How are we supposed to do it? Because most of us think that it's when our teeth get cleaned up, when we use a lot of force. How exactly are we supposed to do it to avoid all that?
You're supposed to be able to brush gently but thoroughly. In other words, have a systematic manner when you're brushing. Most of the time, when we go to the bathroom to brush our teeth, we actually go into autopilot. You tend to start in the same place, go through the same motions, and end up in the same place before rinsing. Now, supposing any area is missed out, it means that that area is consistently missed out all the time. So it's best to have a systematic manner of brushing the teeth such that all the areas of all the teeth are brushed. And you need to take enough time so that you do the thing gently and remove as much plaque as possible. So one can start at the end and go round to the other end, come back, go on the inside from one end
To another.
all the way around, come back a third time, and then brush the top parts of the teeth. That way you will have brushed 3 sides of the teeth and you will have brushed all the teeth. Of course, remembering to do the same thing for the upper teeth as well.
Dr. Lule, sometimes you look at kids when they're developing teeth, and sometimes all their teeth are sort of decayed, and when you look at the mouth, all the teeth are black. What normally causes that, and how can they treat it?
It tends to occur at very young ages, around the age of 2, 3, 4, around that age, and it's usually caused by a baby bottle.
Okay.
Or a cup with some holes in the lid. Usually the contents could be orange juice, tea or milk, stuff like that, especially when it's taken to bed with the child. Some parents feel that when they want to sleep and the baby is making a lot of noise and has a lot of attention, then one way of putting them to sleep is to offer them a baby bottle with something sweet in that. And when that happens, you're again introducing sugar into the mouth and sugar onto the teeth, and lo and behold, all the teeth will get decayed. You may ask, why do all the teeth get decayed and very quickly? First of all, the enamel and dentine of young children is weak and soft, unlike that of an adult. So when the decay occurs, it occurs very rapidly. Secondly, whenever we eat, we produce saliva as a response to placing something in our mouths.
Yes.
And it is that saliva that helps to wash away any of the sugar that may be contained in what we eat. So when you're awake, you're always producing saliva, but when you put something in your mouth, you produce more saliva. So this saliva helps to wash away the sugar that you've put in the mouth. Now, when someone goes to sleep and they sleep with a bottle in the mouth, when you're asleep, the salivary flow stops. Because if it didn't, you'd be drooling all night and you wake up and your whole pillow is wet. So salivary flow stops. And if the salivary flow stops at night, it means any sugar that is introduced into the mouth doesn't get washed away. So you are basically fueling the bacteria the whole night.
What are some of the fastest ways to stop a toothache? Let's say I cannot access a hospital at that moment and I'm really badly off.
If you have a toothache and you can't reach hospital, painkillers. That should be the fastest way.
What if I do not have a painkiller in the house?
You don't have a painkiller in the house? Well, times are hard now. You may not be able to access a painkiller after 9 p.m. Because of government rules. And the pharmacy is likely to be closed as well.
Exactly.
You could rinse with salt. Sometimes that can help. Make sure that the water that you use is basically lukewarm, neither hot nor cold. But rinsing with salt can help. If you have a guava tree in the garden and you take some guava leaves, you can crush them, you can chew them, that can help. You can actually boil them in water and use that as a mouth rinse as well.
What is cleansing, the scaling, and is it important? Scaling and how they call it?
Scaling and polishing.
Polishing, yeah. Is it important? How often should we do it?
Scaling and polishing is basically when the dentist cleans the teeth for you. And sometimes when you clean your own teeth, you don't do it 100% well.
Okay.
And frequently what happens is that you tend to accumulate on the surface of the teeth a very hard substance called calculus, which cannot be removed with a toothbrush. And that's where the dentist intervenes, and he removes it for you. And this calculus tends to accumulate over the time, even if you brush well. So having the dentist to clean the teeth helps to maintain and promote dental health. A minimum of once a year should do. But some people prefer to attend to the dentist every 6 months to really get your house in order very well. If you haven't brushed your teeth very well, sometimes the effect of the accumulation of substances on the teeth, that is plaque and calculus, causes the gums to become inflamed. The gums become reddened and swollen, and they also bleed when you brush the teeth. And that is a sign that the gums are diseased. So after a good scaling and polishing, all those substances should be removed, and then the gums will come back to normal again.
Okay. So when the gums normally swell, that means something has affected them, and they'll come back to normal after some time?
They'll come back to normal within a few days, yes.
Okay. Doctor, how has the pandemic of COVID-19 affected the clinic at large?
Well, the first problem is a dentist is actually on the front line.
Okay.
Because I have to treat the patients with their mouths wide open. And as you know, COVID is an infection primarily of the respiratory system. So every time someone breathes out, if they have COVID, the dentist is in the firing line.
You're at high risk of getting the COVID-19.
That's right. It's not something for me to smile about, really.
Yeah.
Because it could be my life. As I am, I'm almost 65. So I'm getting into the vulnerable age group.
On the side of the patients, have they been affected as well?
They have been affected, but on the side of the staff, if we go back, the transport costs have risen, and so it has been difficult for the staff to travel every day because of the increase in the costs. And on my part, because the staff would have been traveling in public transport, we tried to minimize the contact of the staff by asking them to live in for a whole week. And then they spend the weekend at home, but during the week they actually live and stay here. So I've had to provide accommodation for the staff. And this is something that our president advised, and we followed.
How have you managed to do that? Because it's not been easy. Normally, it's not like you've been giving them accommodation.
No, but you provide enough facilities for them to be comfortable, and they accept, because it's also very risky if they still have to travel every day of the week to and from home. Then they're also risking contact with strangers on a daily basis. So I felt it is actually better, not only for their own safety, but for the patient's safety as well. The other way it has affected us, actually, because we the dentists are on the front line, We actually went on holiday here even before lockdown came. When we realized the risk of the coronavirus entering Uganda, we actually closed the clinic. And I told my staff, you have to take a holiday until this is over. So I gave them a little bit of money, and I thought it would be for a couple of weeks. And I said, you know what? Better you go home rather than face the risk of getting infected. So we closed shop and we all went home. That was the first way that the pandemic affected us. And when the President Museveni announced the lockdown, it actually found us at home. We were already prepared for a lockdown. We actually went on lockdown voluntarily ourselves. Yeah. So that was another way that the pandemic affected us. And to actually get back here, I had to think of ways of minimizing the risk of cross-infection between the staff, between the patients and us, and between us and the patients. So we devised a method here of having the surgery wide open, all windows and doors open, and a ventilation system with these fans. There's one fan there and one fan there. So what we do, I place a fan behind me, but it is aiming in between me and the patient, and it blows air in between us. So when either of us breathes, the air shoots past us and it goes towards the window. And at the window is another fan that is blowing out.
Wow, that's a brilliant idea.
So when I set this up, I asked the cleaner to go down to the shops and buy a couple of cigarettes. So I switched the fans on and lay in the chair. And then I lit the cigarette and puffed on it. And it was easy to see where the smoke goes. And that made me feel safe. And it also makes the patients feel comfortable as well. There are some complaints that have increased, and that is tooth sensitivity or hypersensitivity of the teeth. You see, right now everybody is health conscious with respect to the pandemic. And before the vaccination arrives here, one has to rely on a good immune system. And one of the ways to increase the immune system is to take lemon with a few other things, garlic and stuff. And so a lot of people have increased their use of lemon or lemon juice, either in their food or in their tea or in their drink. Lemon now has gone up amongst the list of things that people take for their health. Lemon, unfortunately, is highly acidic. The pH is around 2, which is very acidic.
Yeah.
And that has had a huge effect on the teeth. People are coming in all the time with sensitive teeth. And that is a huge, huge problem because they're not that easy to treat. So, yes, the pandemic has slightly altered the way in which patients present. And with that, it would be advisable for the people to learn how to minimize the effect of lemon on the teeth. We can't deny you your lemon because it's good for you. We all want you to have a good, strong immune system. But the teeth were not designed to have such an onslaught of acid on them. All the enamel gets removed and the teeth become sometimes unbearably painful, even if it's just trying to eat a piece of bread. So one way to minimize the effect of lemon lemon juice on the teeth is to use a straw. When you use a straw, don't place the straw at the tip of your mouth, at your lips, because when you suck in the lemon juice, it splashes first across your front teeth and then to the rest of the mouth. Place the straw as far in your mouth as possible, and then when you suck on the lemon juice, just swallow it immediately without it moving around in the mouth. So avoid it in things like lemon tea, which you have to drink and sip. And then hopefully immediately after introducing lemon into the mouth and drinking it, then rinse it out immediately. Have a good rinse or brush your teeth and get rid of as much acid as possible as soon as possible.
Dr. Ntwatwa, what would be your appeal to Ugandans on the safety of their teeth?
One needs to avoid as much contact with the teeth, but you may continue to take the lemon. Brush your teeth well, gently and thoroughly, and if you have any problem, attend the dentist early so that anything can be seen when it is at the early stage.
Okay, thank you so much, Dr. Lule.
It's a pleasure being with you again.
Maintain a safe hygiene for your teeth by brushing daily every after a meal. Let's hear from the staff of Ntwatwa's Dental Clinic here in Bakuli. Having heard from Dr. Ntwatwa Lule, let's hear from one of his staff. Hello.
Hello,
What's your name?
I'm Jennifer Lunkse.
Jennifer, what has been your experience working with Ntwatwa Dental Clinic?
The first experience, I have been exposed to a lot of people. Another thing, I'm exposed to the machines, to everything, because it's a big clinic. I'm exposed to a lot of people, I think, and a lot, I can't say.
What have you benefited from all this?
Benefits, there are a lot. First of all, if you add up your experience, you're experiencing like working with a lot of people, it's helped you to get a lot of knowledge from other people, and to work with a doctor, you get more you get more experience.
Jennifer, how has it been you living without going back home just to stay and help out your clients?
Okay, it's uncomfortable, but because of our lives, I have to stay. I started staying because of Corona, so I have to stay to keep my life and the patient's lives.
Okay, thank you very much. Healthy teeth contribute much to our positive life. Remember, living a safe life is your right and responsibility. I am Ishimwe Kathy. Stay safe.